Hi, this is Dr. Ariane from the Movement Paradigm. Today I'm going to talk about one of the most powerful tests that you can do, which is a comprehensive stool test. So, whether or not you are actually having digestive issues, this can be such a profound test to help explain some of the symptoms or concerns that you might be having, whether that's skin issues, headaches, migraines, neuroinflammation, immune issues. Regardless of what you're experiencing, this can give you a lot of insight. And hopefully, today will give you a little bit more information about how that's possible. So maybe you have been experiencing health issues for quite some time and you've been to a GI doctor and they have even recommended potentially a basic stool test, or you've gotten lab values, but when you get your lab values back, everything looks normal, yet you don't feel good. Well, this test, if we think about the power of the microbiome, is going to give us so much insight to our bacteria, to parasites, to infections. And so we're going to dive in. I'm actually going to share with you a stool test so that way you can get a little bit of insight into what it looks like and how we could potentially interpret this information. And most importantly, correlate it with your clinical symptoms. So with any test that you take, whether that's a lab test or that's a stool test or micronutrient panel, it doesn't matter which test you're taking. The most important thing is to pair it and match it with your clinical presentation. Just like a MRI of your low back that might show that you have a herniated disc, a degeneration, does not mean that you necessarily have low back pain. So it's the same with this. So we really want to make sure that we're taking into account all of the information and making it appropriate for you so that it can guide your health decisions. So when we're looking at a comprehensive stool test, as I mentioned, we're looking at pathogens, parasites. So on this first page, I want to just point out a few things is that we're looking for pathogenic bacteria here. So things like C. diff, E. coli, Salmonella. And if we can look in the middle where it says detectable limit, so that's the DL, and then over to the right, it's 1.00 E3 or E4, E5. So this is looking at how much of this is in per gram of stool. So if, for example, C. diff pops up on this particular panel, then we might not be experiencing an acute C. diff infection. However, you can have chronic colonization of C. diff, which might make you more susceptible to an infection. So really important, but we really want to see nothing on this whole page. If we look here at the parasites, so in this case, Giardia, which is a parasite, is detected here. So even though it's not flagged as high, it is still something that is very important that needs to most likely be treated, especially if it's correlating with symptoms. When it comes to digestive symptoms, what makes this a little bit challenging is that many of the symptoms overlap. So whether you have H. pylori, you have maldigestion, you have a parasite, many of the symptoms are going to be bloating, some form of potentially fullness, constipation, diarrhea. So a lot of them overlap, which means that you want to really look at all of the symptoms and then also try to understand what are the things that pop up on this stool exam that might be relevant for this person. So now we know a parasite is a possibility. So now when we come down here, if we look at the H. pylori, so this is an infection of the stomach. So this is going to be, again, something that's flagged as high. This is very easily transmittable, especially among family members. It also occurs in the likelihood that someone has low stomach acid. So oftentimes you may see a parasite as well as H. pylori. If there's maldigestion of some sort, if there's low stomach acid, then this is a possibility. This can create a sense of fullness, that can create nausea, burping. So once again, this is high on our priority list. This next part is the commensal bacteria. And this is essentially where we're looking at our beneficial bacteria. Although we want everything in this green range, we want everything in a normal balance, too much of a good thing is a bad thing. So, for example, we don't want these to be elevated. So, we want them within normal range. Of course, we do not want them to be low as well. And a lot of these different bacteria are all going to contribute to different presentations. So, for example, if we have a imbalance in Bacteroidetes and Firmicutes, these can affect how we're able to metabolize carbohydrates. So, this person might have an issue with fermentable carbohydrates, for example. They could have weight loss resistance. So we start to see these connections of how the bacteria and the bacterial colonization is affecting this person's overall health. Then as we move down, these are opportunistic or overgrowth microbes. So this is when we're starting to see the not as good bacteria. And once again, here we don't want to see these elevated. So some of these lower numbers, you will actually see a number, but we don't want them to be flagged as high. So Staphylococcus, Streptococcus, these can be associated with more mast cell activation. So if someone is having histamine responses to things, maybe more sensitive to different foods, food sensitivities, food triggers, etc., this is where we start to pair some of these bad bacteria with what's happening clinically speaking. This Methanobacterioceae, this is considered a more methane producing bacteria. So this is highly correlated with constipation and bloating for sure. So then we also can see on the stool test, which is really powerful, is that we can see if there's candida. This is not the only test to test for candida. We do look at other tests such as an organic acid test that will give us a lot more insight. But all of these, if we look on this whole page here, these particular opportunistic or overgrowth microbes are extremely associated with systemic inflammation and even specific autoimmune conditions, such as rheumatoid arthritis, autoimmune thyroiditis. So once again, if someone's presenting with an autoimmune or having symptoms of an autoimmune, we can see what that looks like on the stool test as well. And then lastly, so here, when we're looking at these viruses, this would not be the best way to test for these. If we're looking for Epstein-Barr, for example, we would do a blood test. So here we have more parasites, and you can see there's also another parasite here that was detected. So now we know that we're putting these kind of high in that priority list. We're also looking at worms as well, which can be detected. And then when you get down to the intestinal health markers, this is a really important area to look at. So if we're looking at steatocrit, so we're thinking, how is this person's ability to absorb fats? So if this was really elevated, we would know that there was higher amount of fats in the stool. That means they're not absorbing their fat-soluble vitamins, for example. So if the person has a continual issue with vitamin D absorption, for example, then we might be thinking about this. So A, D, E, and K. We're also looking at pancreatic elastase. So this is our function of intestinal health as it relates to digestion. So if the pancreatic elastase is low, which it is here, then we already know that there's going to be a higher likelihood of things like H. pylori and dysbiosis, because if the food is not mechanically broken down, then it's going to create this downstream effect. We can also look at something like beta-glucuronidase, so we can get an idea here of how well we're potentially detoxifying, even as it relates to hormonal activity. How are we excreting? Do we have a good balance of short-chain fatty acids in the gut? Is there any occult blood that can be indicative of something as simple as hemorrhoids, but also it can warrant a referral for colonoscopy. The secretory IgA, looking at the immune system of the gut. So is it low or is it really elevated? Is it hyperactive, hypoactive? So of course here we know that we want to give this a little TLC. Are there antibodies to gluten? So this is really important. So I see this a lot, whether someone's doing a elimination diet or not. If this is high, I'm going to tell them or suggest to them that they should keep gluten out for now. We can also look at eosinophil activation protein. Again, this might warrant further investigation if this was elevated. Calprotectin is one of your inflammatory markers of the gut. And then we also have zonulin. So if this is elevated, we know that there's a likelihood of leaky gut. And this will start to paint the picture of what's happening. So in this particular scenario, we would be thinking about definitely treating the H. pylori number one for sure, then addressing the parasites, and then really at that point trying to address some of the dysbiosis and bring a little bit of balance to the immune system of the gut, which would be really important. So that is a little bit of a nutshell of the stool test. And of course, that's a very, very brief overview, but hopefully you can get an appreciation of all the things that are possible in understanding your microbiome and how that is ultimately directly influencing your health. And it is one of the most valuable tests that I do with all of my patients. I highly recommend it. And if you haven't done a stool test, get excited about it. Yes, it might sound a little bit weird, but it is really, truly valuable. And hopefully you found some of this helpful for you today. If you've already done a stool test, definitely give me a comment. I'm curious to see what information you got from it and how you've applied that. And if it was helpful, give it a like, give it a share, and make sure to subscribe to our YouTube channel, The Movement Paradigm, for weekly tips on mindset, nutrition, and movement. If you would like to schedule an appointment or an evaluation, I'd be more than happy to do that and really get you started on a healing journey. Thank you.